want to talk a little bit about strip scars. According to the International Society of Hair Restoration Surgery, or the ISHRS, that does a biannual census, there are approximately 100,000 hair transplant surgeries annually. And there are probably twice that number that are not reported. So let's assume there might be 200,000 hair transplant surgeries each year. Well, up until recent years, the vast majority of all hair transplants were performed via the strip method. And you know that the reason I moved away from the strip was that the strip scar is unpredictable. It may be 1 or 2 millimeters wide, and then again, it may be 5 or 6 or more millimeters wide. And there are many different examples of strip scars. Some are excessively wide. And frankly, I don't know how these doctors create such wide scars, but they have their method, and hopefully they would show us what those methods are so that the other physicians that are doing strips could avoid these methods. But still, we have this problem. We have millions of patients walking around the world with strip scars. And so how do we manage them? Well, one way would be perhaps to try reducing the width of the scar, but this oftentimes is unsuccessful because there are factors involved in different skin types that predispose certain individuals to wider strip scars, and this is why strip scars are unpredictable. You really don't know how wide the strip scar will be until you perform the strip procedure. So with all these millions of strip scars walking around, and they're embarrassing, they limit your hairstyle options. The question is, what can we do to solve these problems? Well, today we have two really good options. One is to graft hair into the scar, and the other is scalp micropigmentation or trichopigmentation in conjunction with grafting. Grafting is very successful. There are many people that believe that hair will not grow in scars, but it will. Scars are actually quite vascular. And when you make incisions into the scar to place the grafts grow quite well, and the circulation is quite good. And you find in subsequent procedures that as you add hair into the strip scar, it recruits more circulation to that scar, and so the circulation is even better in the second pass through the strip scar. So the growth is typically very close to 100%. Now, you can also do scalp micropigmentation alone or in conjunction with grafting. This is an excellent adjunct to grafting into the scar and can help many individuals get to the point where they, quite frankly, can shave their scalp. And we have examples of that as well. And so there are many options available to manage strip scars, these hideous scars that are embarrassing, unsightly, minimize hairstyle options, and think about it carefully because it can help improve your options in terms of styling your hair and give you more self-confidence, especially when you go to the hairstylist and you don't have to worry that stylist is going to go, oh my God, what happened here?